Great. Thank you.
Hi, everyone. I'm Justicia. I was here yesterday, and I spoke to you about my work. We submitted a poster to talk more about our work, so that's why I'm here again this morning. So to start with, let's take a patient that has come to the clinic. So this patient is a 60-year-old man that has been living on one kidney. He lost his other kidney from a road traffic accident. So for the past 15 years, he's been surviving on one kidney. He finds out that there's a 4-centimeter tumor growing on his kidney. He's been booked for surgery. And during the pre-op sessions, the CT scans and other imaging data that have been done shows that the tumor is somehow invading the renal vein. This is concerning. This could mean that he may lose this kidney entirely and may make him dialysis dependent. We don't want that to happen. So the surgeon is faced with the task of saving this kidney so that the patient can go on surviving with the kidney that he has. So this is where the digital twin assisted surgery comes in. If we have a technology like this, we'll be able to rehearse on this patient's twin prior to the surgery. We'll be able to see the risks that can come up, the complications that could come up, and we can find mitigating features that we can use to preserve this kidney as much as we can. So not only will this help the patient, it will help the surgeon as well, because it will make the surgery more personalized. It can reduce the surgery time and will reduce any trial and errors that the surgeon might think that he might need to make this surgery successful. So if you still want to hear more about this work, I'll be around to answer your questions. Thank you.
Thank you very much.